Regional Institute of Medical Sciences RIMS na World Rare Disease Day 2026 ki Thouram Hospital asigi OPD complex ta pangthokre haidiba Thouram adu rare oiba disease singi matang da miyam da awareness pinaba amadi ngalingi da khangdoktuna anaba singi imung manung da support oina bigi damak pangthokpani haidi Thouram adu da Professor G Sunil Kumar Sharma Director RIMS Professor S Subhash Chandra Singh Head Department of Radio Diagnosis and Medical Superintendent Dr. N. Sugita Devi, Nodal Officer, Rare Disease State Health Service Government of Manipur, Amadi Professor C. Syam Sundar, Head Department of Pediatrics and Nodal Officer, Rare Disease Committee, RIMS Daista Famki.
So, I hope the first celebration will lead to a further second larger celebration next year with the invitation of with the involvement of the patient who are suffering, those are diagnosed, and also the family can be invited here. But we all are here to give information to the public that what is rare disease and what this center is doing or what the government of India is doing for the world on this for this rare disease. My previous speakers have talked about more than 300 million patients, not a small number, even though it's a rare disease, 30 crore, so that's a big number. And we can also look into how the families might have been affected. As it is a rare disease, it's difficult to diagnose, and the family have to go from post to pillars in every part of the country, maybe to Delhi and every center where the diagnosis are very difficult. Once it is diagnosed, again the next is a treatment. So how the country is coping up? So in 2021, Government of India announced the policy for rare disease, and gradually we are expanding. Rare diseases are often chronic, progressive, degenerative and life-threatening. Many are genetic in origin, require lifelong management. Patients and families frequently face delayed diagnosis, limited treatment options, financial burden and emotional stress. Awareness, early detection, multidisciplinary care and policy support are therefore crucial. In this context, again I can proudly say that we are part of the Government of India 13th Excellence Center announced. And this recognition is not merely a title, it is a mandate and a mission given by the Government of India to this institute to serve the state and the people of Northeast also. And it is very heartening to see our role of our team, being it anatomy, we have genetic lab led by Professor Raj Lakshmi, then we have the pathology department led by